Deaths of hundreds of patients at the hands of the British National Health Service sends a stark warning to U.S. advocates of universal health care. One America's Kristian Rouz looks into that matter.
A major scandal is unravelling within the midst of the UK's system of universal healthcare. An investigation by the Crown Prosecution Service discovered at least 456 patients at Gosport War Memorial Hospital died due to neglect, mismanagement and wrongful prescription of painkillers.
The events at Gosport Memorial Hospital were tragic, they are deeply troubling, and they brought unimaginable heartache to the families concerned.
This comes amidst the ongoing standoff over the repeal of Obamacare and healthcare reform in the US, as many Democrat lawmakers and voters are urging a universal healthcare system in the US. Universal healthcare advocates point to the social mandate of such a system, which supposedly provides medical services at low cost or free of charge to the majority of citizens.
We begin the long and difficult struggle to end the international disgrace of the United States, our great nation, being the only major country on earth not to guarantee health care to all of our people.
However, the quality and safety of universal healthcare is oftentimes left outside of the scope of the debate, and the UK's Crown investigation sheds light on the darker side of standardised state-funded system. The Crown prosecution revealed between 1989 and the year 2000, 456 patients were prescribed opioid painkillers in combination with other medicines, which led to their death. Additionally, 200 other patients could have died shortly after their checkout, while many more had their lifespan shortened due to wrongful prescriptions. The prosecutors say the true scope of the scandal is impossible to assess due to some medical records missing.
It is clear to us that those doses were not clinically justified. So my colleagues, the clinicians on the panel, have analysed all these cases and have been able to say that it wasn't justified to prescribe and administer that particular dose of that particular medication for that particular condition.
The Crown prosecution said the UK's National Health Service, or the NHS, has an institutionalised regime of wrongful drug prescription, with patients and relatives being unable to do anything about it. The prosecutors allege the gruesome practice might have been a result of either neglect or intentional effort to reduce the patient's lifespan. After its 4-year probe, the Crown prosecution is now considering criminal charges against those responsible for the deaths.
I have to say that even this morning I've received an email through my own website with somebody alleging that this has happened in another hospital to a relative of them. So I think it does raise the question, but again, the panel is not competent to answer what the extent of this may be throughout the country.
UK Health Secretary Jeremy Hunt apologised to the families in his Parliament speech, saying Hampshire police are working with the Crown prosecution on possible charges. The Crown investigation also found painkillers were wrongfully prescribed to elderly patients. For example, 91-year-old Gladys Richards died back in 1998 over the alleged effects of opioids following recovery from a hip surgery. Police say the opioid mismanagement took place under administration of Dr. Jane Barton, who was found guilty of professional misconduct over 12 patient deaths in 2010, but simply retired thereafter.
We need to ensure that we do not see these sorts of these things happening in the future, and the findings are obviously distressing.
The British authorities are weighing action on this systemic malfunction of the NHS, which must be taken into consideration by the proponents of universal healthcare elsewhere. Kristian Rouz, One American News.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.